So why did you decide to enter into the field of mental health interpreting?
I got an internship right out of college. There was something called a practicum, and I was able to get an internship through a low-income United Way facility called the Health Association. And from that internship, I really fell in love with medical appointments, therapy, doctor's appointments, going in for colonoscopies, like all this stuff that some people are really nervous about because it is quite personal to go into something like that. But I really enjoyed it. Mm-hmm.
Well, the next one is, do you enjoy mental health and interpreting, and why or why not?
I did enjoy it when I was doing it. I did some medical appointments specifically for some dental work that had to get done on a patient, and it was like a root canal, like way back when. And when the doctor or the dentist talked to the patient, there was a lot of blood in his mouth, and I completely passed out on the floor.
Oh.
And come to find out, I don't do well with blood. So if you're going to go in the medical interpreting field, you have to know a little bit about what you can and can't do. And I didn't feel comfortable taking assignments that would put me in that position again, because it wasn't fair to the deaf client.
Mm-hmm. What are some of the challenges that arise while working in mental health settings?
In specifically mental health, you're also dealing with medications, you're dealing with sometimes severe diagnosis. It could be working with a cancer patient and chemotherapy and whatnot. So it's a very vulnerable thing to be a part of someone's personal life for just a snippet of time. Oftentimes for freelance interpreters, you don't really know the client, but you're in this very intensely personal situation. So there's no relationship or bond that gets formed. And I'm a relationship person, so I found it hard for me emotionally to go into a situation where I would, talk about someone's cancerous polyps from a colonoscopy, and then I never see them again. And I couldn't feel like I was developing professionally or emotionally in my job because I couldn't have a relationship with them. I mean, I didn't want a relationship, let's say, but.
Have you ever felt either your health or someone else's health has been at risk during any type of session? Like if you're working with a patient with a severe medical or a mental illness, have you ever felt in danger?
At the Rochester Psychiatric Unit, you're dealing with people who are inpatient, so they live at the facility. There were different group meetings that would happen. It's very uncomfortable because you're dealing with people who are you don't actually know what's going on, but you have to be completely present and aware of all these things at the same time. I didn't feel unsafe, but it was definitely, you're on high alert all the time of what's going on around you.
What sort of mental illnesses have you come across while interpreting?
In that specific thing, schizophrenia, severe autism, but that I would say that's not necessarily a bad thing, it's just a diagnosis. Cancer is really hard to deal with someone who's going through therapy and how it affects everyone different from that. Really being a part of a diagnosis of something, because I tend to be a pretty emotional person, and then I can't, as an interpreter, sometimes stay neutral. So that was kind of.
What made you leave mental health interpreting and come to educational, which is what you're doing now?
Yeah, my degree is in educational interpreting, so I'd always wanted to come back to working specifically in the high school setting. I worked in the college setting quite a bit as well, but you weren't really part of a team. You're in the position designed for this one client, but you don't have a team to work with often. So I like the team atmosphere.
Okay. Ever find it helpful to find a therapist and a patient connect?
Mm-hmm. I like being that bridge between, making sure that the patient get what they need and that relationship is formed between a therapist and the patient. Mm-hmm. At the same time, I think it would be great if there were therapists that could sign fluently enough that they didn't need to have the interpreter. It's almost like, again, does the patient feel comfortable enough really being vulnerable and really getting the help that they need because the interpreter is there?
When interpreting in a mental health setting, did you ever find it difficult to understand their signing because of the defect that they have?
Yeah, and oftentimes that's why I worked with a certified deaf interpreter. Have you guys learned anything about the CDIs by chance?
Yeah.
I think so.
Okay, so it tends to be, again, it's a certified position, like a certified interpreter who's hearing, but a certified deaf interpreter. So they are able to navigate that water of really getting the language, the core information from a patient, not diagnosing a patient with anything, but it works through that language barrier.
Can you describe an average therapy session?
It looks the same as ours, except the interpreter has to sit next to the therapist, so that way there's the visual between back and forth. So a lot of it is placement of where you're sitting, but it looks like any other normal therapy session.
After working as a mental health interpreter who worked closely with a therapist, would you ever consider wanting to become a therapist?
Never. Again, because the relationship that gets formed, I don't think I could handle some of the information. I'm just too emotional.